This week, I wanted to go into a little bit of the research supporting some of the things that core balance training is based on. And this was prompted by people questioning the validity of core balance training, whether it was supported by research. So I wanted to provide some research that kind of helps to support what we do and also talk about how core balance training is not specifically backed by any research at all. Now, with all that said, let's go into some quick studies. I actually found one study that did all the work for us. I searched for core stability and chronic lower back pain because that's the closest thing that I could come up with to what core balance training is trying to do. We're trying to stabilize our lumbar spine. And so that's what I searched, and this is one of the studies. So efficacy of core stability and non-specific chronic lower back pain. So what they did was they looked at all the studies that were ever done on this topic between 2005 and 2020, which they found 420 studies, and they had some inclusion criteria. 49 studies met the criteria. We're going to just skip straight to the results. It says, results, core stability provides great therapeutic effects in patients with non-specific chronic low back pain, reducing pain intensity, functional disability, and improving quality of life. So combining core stability training with other, you could just say general exercise, going to the gym, is even more effective. And it says patient compliance is crucial to determine the efficacy of the intervention. So accountability, sticking to it, doing it daily. And so this is the conclusion. We'll just go through quickly some of the different topics. So one of the studies was the effect of core stability on short duration, so 3 to 12 months, and long duration, more than 1 year of chronic lower back pain. And the conclusion is that core stability is an effective rehabilitation strategy for all chronic lower back pain patients, regardless of the duration of symptoms, on improving pain, disability, and activation of the transversus abdominis and gluteus maximus strength. Another study compared progressive versus conventional core stability. So it doesn't matter which type of core stability training you're doing, it is effective at reducing all those pain and improving quality of life. Another study, core stability versus minimal or no intervention. 49 articles all showed that core stability training was significantly more effective at reducing pain, disability, improving quality of life, muscle thickness, and muscle strength. That's pretty obvious to me. I know some people do believe in rest, but that is not, for chronic lower back pain, that is not the approach that you want to take. You want to improve the support of your spine. Resting your body is actually reducing the stability in your spine. So rest should be minimized to 1 to 2 days. You don't want to go 3 days of not doing something active with your core muscles, or they will get weaker. And that is research-based. Another study, core stability versus general typical strengthening and stretching training. Stankovic et al. Evaluated the effectiveness of a lumbar stabilization exercise program in combination with general strengthening and stretching exercise and showed that a combined exercise program is more effective in reducing pain, improving disability, and quality of life than the traditional exercises alone. So this is one of the things that I think kind of separates core balance training from other core stability type exercises, is how we are trying to integrate daily life, whatever you're doing with your body in the other 23 hours of the day, or 16 waking hours of the day, when you're not doing the exercises. The idea of applying that to the rest of your life is going to be more effective. Very important thing that I took from this study was just doing 30-minute exercises alone in no cases is going to be good as doing the exercises and then applying it to other things. Core stability versus Pilates, cognitive functional treatment such as cognitive behavioral therapy or proprioceptive neuromuscular facilitation. These are all just complex words. The improvement was significantly greater with lumbar stabilization, which is core stability, for all the outcome measures: pain, range of motion, disability, and core strength. So more effective for core stability than those other things. Core stability versus treadmill walking. We're going to find that core stability was superior. Core stability using a training device versus on a mat. What we found here was that performing the core stability on an unstable surface is beneficial compared with on a stable surface, which would be a mat. So that's something to think about as well. The last thing I wanted to go over was in the discussion section. They mentioned something that I think is the most important thing of all. And it doesn't matter what you do. If you're not actually doing it consistently and committing to it, then might as well just be reading books and research studies to find out what's the best. But that's not going to get you anywhere. It's about the doing. And so it says the success of stability exercise interventions is dependent on the high adherence of the patients and the correct dosage. And so I think that that's another thing that core balance training does well, is emphasizing daily, every day. And we're not trying to go for 2 to 3 hours in a session. We just need 15 minutes. And so the dosage could be small, but the consistency is the most important thing. If there's anything that you take away from this spiel that I'm giving, that's what I want it to be, is every day. Doesn't matter if you take a lesson that day or watch a lesson. It doesn't matter if you having a good day or a bad day. If you can get down on the floor and connect to your core by just doing the back anchor, that is taking a step towards your goal. And those individual steps accumulate to make very, very big progress in the long run. Most important thing to me, and also it looks like to a lot of the outcomes of these studies, is actual compliance, adherence. Participating in core balance training and committing to something is the most effective thing that you can do. As long as you're doing something and working towards a goal, it's more effective than the next person over that might be obsessed with research. In general, research is always changing. And so the research that we know today might be either disproven or change tomorrow. For that reason, a lot of research is anecdotal. That is all we have in core balance training right now. Anecdotal evidence, which is just individual people telling their story of how it helped them. And I think that's really one of the most reliable and effective reasons to do things. People do core balance training because it makes them feel good. It makes their bodies feel good. It reduces their pain, and they tell their friends and their family. That is, to me, more important than what a study says or what gets published. So you need to get out there and do, and sometimes that requires taking a risk or a leap of faith and is feeling for yourself whether it helps your body. One of the guiding principles of this program is that I want you to always be feeling your body and receiving the messages that your body is telling you to guide your decisions on what you do next. That is listening to your body. That is the art and the science of listening to your body. And it is the most valuable skill that you can develop for getting out of back pain. I do this exercise, it makes me feel better, or it makes me feel worse. Tomorrow, I will base my decision based on that. And that development of body wisdom, that accumulation of body wisdom, will eventually guide you towards what works for you. We talked about research. We talked about anecdotal evidence versus published studies. Why do we do things, right? We do things because they work for us. We do things because it makes us feel good, makes our body feel better. And if something's working for you, I encourage you to do it. It doesn't matter what the research says because it's working for you. Until next week, get down on the floor and connect to your core.